if we go ahead then, please, Graham, if you wouldn't mind to introduce yourself,
Okay,
that would be amazing. Thank you so much for coming to talk to us. We really appreciate your time and your assistance, and we'd love to hear from you. Thank you.
that's marvelous. Thanks ever so much, Davina. And I just wanted to thank Susan Peacock and Hugo Mini for firstly for inviting me and for making all the arrangements and organising this. It's much appreciated. Um, just before we begin, I just wanted to tell you a little bit about myself for the members of the group who perhaps don't know me at all. I my name's Grahame Morris. I've been the Member of Parliament for Easington since 2010, when I was first elected. I did work for my predecessor, John Cummings, for a number of years, for 23 years actually, before John retired. Before that, I used to work in the health service, and I used to work at the Sunderland Hospitals Group, and I worked in the pathology department doing um, uh, analytical tests and diagnostic tests. My particular interest was biochemistry, but colleagues in hematology would do B12 and folate. So I was kind of familiar with the issue. When I was first elected in 2010, I decided I wanted to uh, use my health background. When I left the NHS, when I left the pathology service, I was elected as a local councillor, but I also served on the Community Health Council. And then after '97, for a number of years, I was on the Hospital Trust Board at Sunderland, Sunderland Royal Hospitals, what's now City Hospitals NHS Trust. But I did serve on the Health and Social Care Committee from 2010 to 2015 during the first Parliament. And during this time, I mean, the committee was originally called the Health Committee, and it changed to the Health and Social Care Committee. But it did a number of inquiries on topics that might be of interest, including the management of care of people with long-term conditions, public health in England, and childhood obesity. I'm just getting a request there. Yeah. My particular special interest, which I've maintained, even though I'm no longer a member of the Health Select Committee, is in relation to cancer care, both diagnosis, but particularly treatment and non-invasive therapies. And I'm vice chair of a number of all-party cancer groups, including the all-party group for radiotherapy. And I've participated in quite a number of debates, lobbies, events to highlight some of these issues in relation to cancer care and the need to have a more effective, not just diagnosis, but treatment of these particular conditions. Just to like tie into the group in Horden, and back in 2010 at Hugo's request, I did do some interviews with a number of people who had B12 deficiencies for the B12D charity, and I think those videos are still available on YouTube. It would be terribly remiss if I didn't mention Dr. Chandy, Dr. Joseph Chandy, who sadly passed away in December of last year. Dr. Chandy was such an amazing man. He spent his entire life serving the community of Horden. And he initially studied in India, but he was a GP in Horden as long as I could remember, I believe for around 40 years. And there is a publication, a book, co-authored by Dr. Chandy and Hugo, Vitamin B12 Deficiency in Clinical Practice. And I'm pleased that Hugo is listening, and he might tell us a little more about what's come out of that. My understanding from conversations with Dr. Chandy, why he developed such an interest in it, was that he noticed that people were suffering from symptoms that look to him like B12 deficiency. Now, coming from India, where where there is a where veganism is much more common, strict vegetarianism, and also uh, dairy-free diets. He'd previously seen this, but in the United Kingdom, in Hordern and in County Durham, he was seeing it in people not who were, um, refraining from eating meat for religious reasons. He was seeing it in people who did eat meat. And Dr. Chandy, to my knowledge, was the first to notice that B12 deficiency could occur without macrocytosis in a blood condition where the red blood cells are larger than normal. That's the kind of, or it was the established method of identifying B12 deficiency. I might say I'm not a doctor. I'm a politician, although I've got some background in clinical pathology. So please, understand that I'm not a medically qualified person. Uh, I'm certainly aware that Dr. Chandy had welcomed the new uh, the new guidelines, or would have welcomed them, that were published by the National Institute for Health and Care Excellence, which we would call NICE. There's a feeling that it's likely to be an improvement. However, the guidance needs to make its way into the mainstream to improve GP diagnosis and the treatment of B12 deficiency. At the moment, the pioneering work at Hordern and some other practices is a bit of an outlier. So moving on to what's happening in our own area in East Durham, Dr. Chandy discovered that vitamin B12 deficiency is very much under-recognised. And of the patients at his medical practice in Hordern in 2015, the total number of patients were just short of 6,000, 5,760 patients. You probably are aware of this already. There were 1,036 patients, 18%, that were diagnosed with vitamin B12 deficiency. And this was confirmed by whether their symptoms were relieved by giving supplements of B12 by injection. So it's kind of empirically proven this high incidence of vitamin B12 deficiency, because once the B12 supplement was given by injection, that was reversed. Just in terms of the constituency position, as you can see from the second slide, the population of our constituency of Easington is 81,510. And in the second icon, we can see the age profile. About 20% is 65 or over. About 22% are in the age bracket 50 to 64. About 18%, 35 to 49. 7%, 8 to 24. And about a fifth are aged under 7. And perhaps what's different about Hordern comparing with other areas that have got high levels of deprivation is looking at country of birth. 97%, this is within the Easington constituency, 97.3% are Indigenous, were born in the UK. About 1% were born in the EU, and about another 1% were born in the rest of the world. Now, looking at Hordern, Hordern is one of the most deprived communities, not just in County Durham, but in the whole of the country. I find it incredible, and I've raised it on numerous occasions, that when the government launched this policy of levelling up, that was to provide funding and resources so that those left behind areas could access the funding in order to bring about regeneration and improvements. That Hordern wasn't successful. because by any objective measure, Horden is ranked in the top 1% of the most deprived neighbourhoods in the UK. And looking nationally, Horden was ranked 291 out of 32,845 in 2019. And the position had worsened because it was ranked 396 in 2015. And County Durham as a whole is ranked 65 out of 324 local authorities. That was in 29 in terms of deprivation. And the source for that's pretty solid. It's the indices of deprivation. So looking at the health of the wider community, we have a higher than the national average prevalence of dementia. We have in Horden, it's 0.74%. We have higher than the national average for depression. It's 15.6% of patients that are aged 18 and over and diagnosed with depression, compared to 13%, the England average. Dr. Chandy concluded that common diagnoses that responded well to vitamin B12 supplements, common diagnosis that he would see every day in his surgery, and that was both for dementia and depression, responded well to vitamin B12. In relation to obesity, the highest prevalence obesity in the country, and there have been some links through some studies of B12 deficiency and obesity, we've got just short of 20% where individuals are clinically obese. If I can say something about the wider determinants of health, or maybe of ill health, I'm a big fan of Marmot, of the Black Report, of the the various studies that have been undertaken into health inequalities and unequal health outcomes. But there's a clear link between general socio-economic, cultural, and environmental conditions and health outcomes. And I've seen some, although I haven't got a slide for it, I've seen some graphics that illustrate this very well in London, where there are wide variations in terms of deprivation. So on a journey on the tube line from Westminster, going through Belgravia, Victoria, Pimlico, and then south of the river into Vauxhall, and moving on down towards Brixton, the variation in life expectancy is really quite incredible, from the most affluent areas to the poorest areas. It's more than 10 years. And there are a number of factors that impact on people's health. I mean, we know about, living conditions, poor housing, dampness, black mold, not having proper access to healthcare services, water, sanitation, poor educational opportunities, lack of work opportunities, poor diet. All of these things contribute to worse health outcomes. It's quite interesting that there was a survey that was carried out of UK households living in cold, damp, and poorly insulated homes. And this was an analysis carried out by the English Housing Survey, by the Institute of Health, Equity and Friends of the Earth. And it seems that UK homes are far less efficient than those elsewhere in Europe, according to the Institute of Health. and that was just this year. So maybe we shouldn't be so surprised that there are better health outcomes in other countries in Europe. I'll move on to hospital admissions. This is quite an interesting slide. Again, updated because of the figures that have been added because there was this dip due to the pandemic, due to COVID. But personally, I think it's a scandal that in a relatively wealthy, modern industrial country, in a developed country, people are being admitted in increasing numbers, admitted to hospital, hospitalized because of malnourishment and poor diet. Now, the number of cases of patients treated in hospital for vitamin B deficiencies has tripled over a decade, from 57,000 10 years ago to 162,000 last year. Now, Michael Marmot, who's the public health expert, Professor Marmot, he was quoted in an article in The Guardian. He says, "The skeptic in me always asks, is this real or increased recognition of the problem?" He said, "But that massive increase, it seems likely that's got to be a real component." There's a worry that we don't know the scale of the problem, especially for children, as we don't in this country do routine screening for deficiencies. And it's a crucial issue because vitamin B12 is so important, not just for general health, but for brain development. I'll just click onto this slide here about the Marmot study. And this is in part about excess deaths. And this covers the 10-year period, from 2011 to 2019. And in that period, 890,000 people were dying earlier than expected, earlier than they otherwise would have done, had they experienced the death rates seen in the least deprived quintile. That's the least deprived 20%. So you can see there's a huge difference, not just in life expectancy, but also in terms of premature deaths in this period between the wealthiest and the poorest areas, and also between males and females to a degree. There's a much higher prevalence amongst males. And hospital data from last year shows that 800,000 patients were admitted to hospital with some form of malnutrition or nutritional deficiencies. The reports listed on the right-hand side by Michael Marmot, they may be of general interest to those participating. Okay. So we know there's a problem, and there's this issue of correlation and causation, isn't there? And the best explanation I've heard of that, to differentiate between the two, because to establish there's a correlation between vitamin B deficiency and the manifestation of illness and disease that Dr. Chandy was convinced of, and there being a causation and there being a correlation, which means the two are linked, but not necessarily by by cause and effect. And somebody explained it to me. On a sunny day, the sales of ice cream increased dramatically. So if you plotted a graph of ice cream sales on a sunny day, it would be going like that. If you printed a graph of the incidence of sunburn and subsequently skin cancer on a sunny day, you get a similar graph like that. There's no doubt about it that, with two similar shaped graphs, there's a correlation. There's a correlation, but there isn't causation, because what we know is that the cause of the increased ice cream sales is the effect of the sun. It's not the fact that the ice cream has caused burns and skin cancer in the individuals who are sunbathing. So I think it's a fundamental point that it's important to understand. I wanted to say something about representation in Parliament, because I don't want to preempt the questions, but I think it's important that the issue's been raised. Firstly, in relation to the food standards requirement and the possibility of increasing B12, vitamin B12 in the diets of children through the incorporation of more B12 in school meals. That's been raised. The instances of vitamin B12 deficiency and anemia that have been attributed to nitrous oxide. You may be aware of this. The misuse of nitrous oxide creates a vitamin B12 deficiency. And indeed, our own Police and Crime Commissioner in Durham, Joy Allen, campaigned vigorously for a clampdown on the misuse of nitrous oxide. And last year, nitrous oxide was made a Class C drug. I mean, I think people tend to think of it being harmless. It's laughing gas. It's inhaled by individuals to get a high, but there is a serious side to it. The other point I wanted to raise in terms of what issues have been raised, and this is making B12 injectables available over the counter in pharmacies. And indeed, that point was put to the minister, or has been on several occasions. But vitamin B12 is only available as an injection, excuse me, and therefore it's classified as a prescription only drug under the regulations. As the minister said, suitable training needs to be given for its administration. The condition for which it's prescribed also means that the product, the injectable B12, must be classified as a prescription only medicine, and therefore no assessment has been made of the potential merits of making these products available over the counter. Well, that begs the question, why hasn't such an assessment been made? Okay. The other point that I wanted to make you aware of is the funding, the last icon there. The funding available to pharmaceutical companies and also to researchers to conduct medical studies into B12 injectables. Now, in December of last year, the government answered a parliamentary question about whether the department was making funding available, firstly, to pharmaceutical companies, and secondly, to researchers to conduct medical studies into B12 injectables. And the answer that came back was the Department of Health commissions research through the National Institute for Health and Care Research. The National Institute for Health and Care Research is not currently supporting pharmaceutical companies or research specifically on injectable vitamin B12. The NIHR welcomes funding applications for research into any aspect of human health, including injectable vitamin B. Applications are subject to peer review and judged in open competition, with awards being made based on the importance of the topic to patients and health and care services, value for money, and scientific quality. So what the minister's saying there is, no, they're not supporting any current research, and no applications have been made either by pharmaceutical companies or researchers. Okay. some time ago, when I was first elected, I tabled this parliamentary early day motion, recognising the benefits of vitamin B12 therapy, and putting forward the point that greater emphasis had to be placed on recognising and treating B12 deficiency, which can be the cause of ill health, unemployment, recognises the replacement of the missing nutrient can restore uh, um, enthusiasm, energy to the individual. And many of the drugs used to treat misdiagnosis are far more expensive and can have lasting adverse side effects. So it was a call for the health community to recognise and do further research into vitamin B12 deficiency to ensure the needs and symptoms of patients presenting can be treated in a consistent way that is cost effective without side effects and completely safe. Now, what I've done is we've updated that and retabled it this week. So it might be an opportunity there to see what more general support there is, supplemented by further questions to ministers about doing the necessary research and amending the protocols in terms of prescriptions. So essentially, from a layman and a politician's point of view, I think that's my conclusion. So I thought I'd leave some time for questions, and if anybody would care to ask me anything or seek some clarification, I'd be only too pleased.
I mean, I've got one question in terms of like the minimum level set. I think it's too low. And in Japan, they set it at 550. So why can't we do that in this country? And Japan has longest living people. So
But can I just say, I think that's a really good point. And Japan have got some particular problems with the age of their population. You're absolutely right. People tend to live longer in Japan, and some of that is attributed to a healthier diet. But they are having difficulties now because of there's 130 million people live in Japan. I visited it quite recently because I serve on the Transport Select Committee, and we went to look at their high-speed rail. And I think something like 20 or 25 million of their 130 million are age 65 or over. And the prediction is that in 20 or 30 years' time, because they have such a low birth rate, the population of Japan is going to fall by about 20 odd million.
oh, great.
And that puts huge pressures on the health service, on social care, on logistics, on the transport network, on the rural areas. So I think they've got a sharper focus on the need to have effective health interventions because they are struggling to find the personnel for the health service and care service. So I do think that's a relevant example. Annie's got a
Is
hand
that
up.
something? Yeah, is that something
Annie,
that you can put forward in terms of as an MP
yes, yeah, I
to
will. I'm making a
increase
note
that
of these.
lower level? Okay, so is it Annie or Sue that was first? I didn't see really. So either one can unmute yourselves, and maybe Annie, if you want to go first.
Hi there. Hi, Grahame.
Hi.
I'm a clinician based in the northeast in Gateshead, and I have offices in London and Scotland and Ireland. I see a lot of patients with B12 deficiency, and usually they're quite severe by the time they come to me. So one of the things that I was thinking, I was just reminded of was Professor David Smith's research from Oxford University, looking at the levels of B12 that are below 500, and age over 60. If your level is below 500, your brain shrinks at twice the rate it should, and also your cognitive decline is 6 times more likely. And that was way back in 2010. And so the levels, you know, the reference ranges are different in every part of the country, which just is unbelievable, really, because cholesterol's the same wherever you go. And I've talked to labs, and you know, I've talked to you know, various experts. Martin, well, I can't remember his name, the guy that's heading a parliamentary inquiry into lab ranges and stuff, and so it's really interesting to me that, you know, B12 isn't available over the counter in the UK, and I heard you say because it's a POM, but you know, methylcobalamin form of B12 is considered a supplement, so people do inject that form of B12. And secondly, in Europe, you know, you can go in most countries in Europe and buy B12 over the counter because it's a vitamin, in comparison with things like insulin, which people are allowed to have and self-inject, and you know, can kill themselves quite easily. It's a lethal drug, but B12 is not. So that's the kind of two things I just wanted to put in there, really.
That's a really good point as well. And I just wanted to also say it's available through beauticians as well, isn't it?
Well, B12, yeah, I mean, that's an age-old argument, isn't it? That beauticians give B12 injections, and they can give all sorts of things, Botox and all sorts. That's a whole other discussion. But as somebody who does also run professional development courses on, particularly on B12 deficiency, I don't allow them on my course. But actually, you know, the issues around, you know, getting it, and the issues around it being a POM, and the issues of the sort of levels, the reference ranges and stuff have been ongoing for years, you know.
Yeah. Well, Emma's put a comment in the group chat. I don't know if you've seen that.
I haven't, no.
And she says, I agree with the others. B12 is a vitamin and won't do any harm if someone takes too much by mistake.
Yeah.
I'm sure people can be taught to inject themselves with B12 by a nurse or a doctor. It seems crazy as they're very willing to prescribe me injectable hydrocortisone,
Yes.
which is a steroid,
Yeah.
for Addison's disease, and yet they can't prescribe a B12 to inject. You know, why one and not the other? I mean, that's a fair point. Yeah.
There's very good points have been raised. So, you know, if you can take those with you, Grahame, to try and see if you can increase that level, because that would be so helpful to all of us, so especially the sufferers, you know.
I think there's a couple
Sue,
more hands up.
yeah, Sue's next. So Sue, would you like to ask your question? Thank you, Annie. Thank you, Grahame.
Hi. I agree with Annie. I was going to ask the same question about the fact that B12 is available in other countries over the counter, and surely they must have done their own health assessment and risks and so on. And people in other countries don't seem to have expert training from doctors and nurses to do these injections. And in fact, during COVID, when some people were allowed to self-inject their prescribed B12, there was a doctor who posted a video online, a training video, and you know, you could watch that and learn quite satisfactorily how to do an injection yourself. There are loads and loads of videos on YouTube. So people who are denied injectable B12 and then choose to go and buy it themselves often simply learn how to do it via a YouTube video. Now that's not ideal, and okay, we you know, perhaps we should have nurses and doctors showing us how to do it, but it's not rocket science. It is not that difficult. And so I think this issue about denying us the right to buy it over the counter off prescription to self-inject simply because the rules and regulations say it's a prescription only item because a needle is involved is ridiculous, because like you say, people can have insulin and they can kill themselves with insulin. But you know, you can't kill yourself with vitamin B12. And other people use injectable forms of treatment and don't have to jump through the hoops that we seem to have to jump through for a non-toxic vitamin. And the other thing I wanted to ask was, I have raised these issues with several MPs. MPs come and go. we had a wonderful MP in our constituency, David Drew, who was working on our behalf, and he raised the question in Parliament. Sadly, he lost his seat. I had not had such success with the subsequent MP, but we have been working also with Tracy Whitty's group, who work with Jane Hunt, I think it is, who is working on our behalf as well to raise these issues. And at one point, we were asked to provide patient histories, information to the Health Committee. And we provided a lot of information to Nadine Dorris, who was the minister in charge at that time. But then she moved on to culture and sport or something, and obviously has subsequently left anyway. And each time somebody moves on, we seem to have to start the process all over again. And I find it so frustrating that if in any other walk of life where a new person came in to take a new job, that they would pick up the ongoing issues. And yet when we seem to raise these issues in Parliament, if the person moves on, we have to go back to the beginning and start again.
Well, it's not unique to your group or to health. It's not unique to the B12 group. I've been involved with Catch Up with Cancer and advocating for advanced radiotherapy since I was elected, and I've lost count of the number of ministers that we've actually had face-to-face meetings with, the number of questions and debates and about the efficacy and efficiency of this non-invasive treatment, the cost effectiveness of it, the unequal access to it. I mean, fantastic access in London at some of the best hospitals in the world, but less so in our own region in the northeast, and others as well in more remote areas. But you can just hear the sound of the penny dropping, and then there's a reshuffle. And although the civil servants stay the same, you have to start and make the arguments once more. And it's so frustrating. You know, I completely understand your sense of frustration about this, but I don't know what the solution is. The schools minister, Nick Gibb, was in post for 12 years. I'm not sure whether people who are advocating for new schools or changes in schools policy can say that they got a better deal because he was there for a long time. But certainly, you know, if you understand the brief and you've got civil servants around who are providing the necessary impartial and correct advice, then I can't understand why it's so difficult. I really can't. I haven't got the answer, but I mean, that's, you know, it's a statement of how it is, and it applies equally in other sectors, in transport and so on as well.
Thank you.
Thank you.
I
Julie?
might say I knew David Drew in Stroud, and he was a lovely man.
Brilliant. Absolutely
You
brilliant.
know that lady you mentioned from Loughborough?
Tracy Whitty.
She had a question this morning early this afternoon in education questions. I don't think I've met her, but I'll make it my business to seek her out.
Okay, thank you.
Okay, we've got Julie. Julie?
Hi, Grahame. Can I just say thank you? Because anybody that's doing anything to raise the issues about B12, I think you find that everybody here has gratitude for that. And those of us that also try to raise it in different ways appreciate some of the red tape and brick walls that we hit. And I was just wondering if you've got any thoughts, because I think for change can come from the top and change can come from the ground. And actually the best change comes when it comes in both directions. So I have I have sadly been hospitalised in various parts of the country. I totally accept your point that having now been cared for by a London hospital, the standard of care is dramatically different. And I think that is sad, because N in NHS stands for national, and it's not. And H stands for health, and I don't think it is either. It's a national illness service. It's much better at treating an illness than returning you to health. But I have tried at a local level. So the only option you have, you know, if a GP just bats you away as, I'm the doctor, you're stupid, go away. A local hospital, I now know from my records that my B12 deficiency was apparent 10 years ago. And even though I was asking the questions, nothing happened. So I have gone through the complaints process, and I keep all I do is get batted away. The local hospital didn't even respond to me in the 6 months they're supposed to. So I then go to the ombudsman, who said, "Oh, sorry, you'll have to wait. They do respond to you." And you go, okay, you know, the GP's practice doesn't even respond to a formal complaints letter under their stated policy. The ICB tells me they can't respond to me because the practice won't respond to them. Now, where do we go when you just keep hitting the constant brick walls?
I mean, there are avenues when patients are dissatisfied. I mean, I must confess, I was very unhappy with my GP practice in Merton, actually, and the long-established GP retired, and there were a succession of locums, and who didn't know me, didn't understand my circumstances and so on, and frankly wouldn't listen to me because I knew the nature of my conditions, and I knew without some intervention I'd be hospitalized, and I was kind of poo-pooed, and precisely as I predicted, I was taken to hospital, and I discharged myself with the promise that I would go and see the GP on Monday, the one who had refused to treat me the way I'd asked. So I thought, yeah, I'll definitely do that if you can get me an appointment without me waiting 2 weeks. Yeah, we've got an appointment Monday. So I went to saw her, and said, I told you what would happen. It's cost the NHS I don't know how many hundreds or thousands of pounds absolutely unnecessarily because you wouldn't listen to what I had to say. And she said, well, if you don't like it, you can go and go somewhere else. I said, well, I've been in this practice for 60 years, but if that's how you feel, that's just what I'll do. So I'm in a fortunate position because I'm in London, you know, 5 days out of 7. So I was able to register with a GP practice near where I live. And I find both the access and the consistency and quality of service is much better. And you're right, Julie, it shouldn't be like that. And the quality of the hospitals is much better as well. And, you know, my politics, I'm a socialist. I think we should have the application of resources to those who are in greatest need. And it's failing at the moment. I mean, I know everything's broken, but I think the health service is broken, and it needs a new broom. I think to get to grips. And some of the issues we're not talking about huge sums of money. It's the application of the appropriate protocols, common sense, and logic. And I'm quite convinced it would be more cost effective than the current approach. But I don't suppose that's an answer, but I completely empathise and identify with what you're saying.
Well, can I also, I have also written to the Health Minister, and a reasonable number of weeks after I wrote there, I haven't even had an acknowledgement.
Yeah,
you
see, Julie, what's your connection with the Horden group? I mean, anybody who's my constituent, if you have that experience, the best thing to do is contact your MP, contact me if I'm your MP, because I can always get a reply. Because if they don't reply, I'll stand up in business questions on a Thursday and shame them, because they're supposed to reply within how many days? Yeah, they're supposed to reply within a set number of working days. 20 days actually it is. They've got to reply. But you know, I'm not averse to doing that.
Well, sadly, you're not my MP.
All right, okay.
Or you would probably have heard about this already. But there are many of us here and many of us in related groups like this who are trying our very best, but we cannot get the shift in the movement. Well,
all we can do, I mean, I haven't got a magic bullet or a magic wand. all I can do is say, you know, I'll do what I can. If I can then join with others, I mean, I
Yeah, I
don't care
think if you
which
can
part.
join with Jane Hunt and
Yeah,
I
yeah,
think
yeah.
there's a lady called
I'll find
Rupi
her.
Hack. Is it Rupi Hack? Somebody MP I saw.
Rupa Hack, she's one of the
Yeah,
London MPs.
I think she's
Our
also
sister used to be
keen
a
on the
presenter on Blue Peter many years ago.
yeah. And if
Uh-huh.
anybody else knows any MPs, then you
Yeah.
know if we can forward the names
Yeah.
to Grahame, then Grahame will be able to
Yeah.
connect with them. Alf's been waiting, and there are some comments in the chat as well. So if we can
Right.
go to Alf first, and then we'll go to the chat.
Yeah, hello. Sorry, I'm
Hi.
from Norway, so I have no special
Oh,
knowledge
hi.
of the English. Hi, but I can say that I don't think the situation is especially better in Norway. It's much the same, and I can say I have arthritis, and I inject myself with three injections every month, and that's no problem. But you can't get B12, so it's a bit strange. But I'd like to ask you, Grahame, in Norway, I work in the National Audit Office.
Right.
And I can see at your the webpage, the National Audit Office in the UK also do inquiries around health. And do you think this might be a job for them to look into the healthcare issues, not about just B12, but all the supplements we actually miss or lack?
Yeah. Well, I am. It's an interesting point, Alf, and thanks very much for the suggestion. The National Audit Office are kind of the investigative arm of a select committee called the Public Accounts Committee. They're a bit more than that, like, but if the Public Accounts Committee and the chair's a Labour MP called Meg Hillier, want to do an investigation. For example, I serve on the Transport Select Committee, and there's a big issue here because the government's cancelled high-speed rail beyond Birmingham. There was going to be a high-speed line that went from central London, from Euston to Manchester, and having constructed about half of it as far as Birmingham, the government have decided unilaterally they're not going to continue to Birmingham. Originally, it was going to go to Manchester and then up to Leeds as well. Like, but anyway, but the National Audit Office, you might think, well, that's a transport issue, but in order to get to the meat or the kernel of what the issues were, was it cost overruns or bad planning? Why did the public get such poor value for money? The National Audit Office started an inquiry, and it's an interesting idea because the angle or the hook to hang their referral would have to be value for money. And does the current prescribing and administration regime for vitamin B12 in an injectable form, does that meet value for money criteria if people are going undiagnosed or untreated and then they're developing more severe symptoms, more deterioration in their conditions, which has cost implications for themselves, their families, and for the National Health Service and other public services? I think that's a legitimate referral.
Yeah, and
I do.
I don't know if, but in Norway, the Riksrevisjon, as we called, or the audit office, the general audit office, we can. I'm an auditor in accounting, so I don't do this kind of project, but they do on their own ideas investigate.
The last time I got involved with them, Arthur, it was quite a few years ago. I was on Health Select Committee, so it must have been before 2015. Have you heard of proton beam therapy?
No.
It's an advanced form of radiotherapy that uses protons, and it's used in the treatment of brain cancers, particularly metastases and brain cancers. And we had no provision in this country, and people would have to go either to continental Europe or to the United States for treatment.
Yeah.
Subsequently, the government decided to buy 2 machines from Siemens in Germany at a cost of like £400 million, some huge sum of money. when there were cheaper options that could have delivered the same or greater number of treatments, just as effectively in more centres across the country. So we asked the National Audit Office to look into whether it was value for money to spend. Well, it was nearly £1,000 million on 2 sites, one the Christie Hospital in Manchester and one University College Hospital in London, as opposed to the opportunity cost of doing something else with that money to treat the same cohort of patients. And I don't know whether the complexity defeated them or whether it was timed out because of the general election.
Yeah.
But we didn't get to a firm conclusion. But
No.
I think it's a decent point. I'll need to discuss. I'll need to discuss it with more knowledgeable colleagues, Alf.
Yeah, I don't know. I don't know.
I know Meg Hillier. We had some Norwegian parliamentarians over here.
Yeah, I believe it's. It can sound like it is a difference in how the auditor office in the UK operates and Norway, because in Norway they do their own investigations based on their own ideas, and they're looking about one inquiry was how the patients got treated, difference in quality based on where they were living in the country, and that's of course is a money issue, but it could also be but it's an idea anyway. So
no, it's a good one.
It's really good. If you could leave your contact details, Alf, or if you want to join the group and then message me directly with your contact details.
I'm in the group, yes.
Are you okay? Super. Then if you can, then what we can do is connect you with Grahame, so you can discuss it further if that's useful.
Yeah.
Well, I don't think I have so much more to contribute with, but we have, of course, our people in Oslo.
Okay.
Alf,
another point
that's a good lead. I'm grateful. I'll look into that. Thanks very much.
Yeah, thanch you.
No problem.
So
thank you very
Emma
much.
Knight's also pointed out that she has cortisol injections. Not cortisol, sorry. Which injections do you have, Emma? She has some injections for steroids, and that's allowed, yet she's not able to have injections for B12. So that's another example. So it's insulin, steroid injections. These are things that we can use to say, why is one thing excluded but another thing included? And there's no real difference.
No, I understand.
Except the fact that we'll benefit from the B12 and we're not being able to have a chance to inject ourselves. And the other thing is the minimum level. I know if it goes below 550, there's a lot of research that shows the homocysteine goes up, and that brings more risk towards, heart disease, strokes, dementia. So these are important aspects if we want to keep our workforce and our people healthy. If you have an unhealthy workforce, that affects your economy. I'm sure the MPs will be interested in that. So, and also my sister Anjali, she was also mentioning about the cost of the injections. They're getting higher and higher. Nobody knows why.
I did visit a large pharmaceutical company that was based in Peterlee.
Oh,
and they had the capacity. Well, they were their main plant was in Luton, but they had the capacity to make virtually anything. They had issues with orders coming through from the NHS, but they had the production capacity to be quite flexible and to switch production from one drug to another. But I would need to inquire because I'm just guessing what the answer is.
Would you, Grahame? Would you,
I
Grahame?
said I have some information for you, Grahame.
That would be really good.
When all this fight started, Dr. Chandy worked out the cost of B12 injections.
Yeah.
And the average cost was over a period of 6 months, it cost exactly £26 to give these patients injections. Now, maybe it's a little more now, but at that time it was £26 for 6 months injections. And he did inform us at that time that vitamin B12 is the one vitamin that you can't overdose on.
Yeah, I understand that. Yeah.
It's just frustrating.
Yeah.
That the government would listen to pharmacists instead of doctors.
Yeah.
Who knows more about these things than doctors?
Yeah, absolutely.
They use them every day. It just irritates me to death. I'm so sorry, Grahame.
No, it's
Okay,
absolutely
I know Grahame
right. I mean,
has to go, so
that's useful information about relative costs. Yeah,
it is
absolutely.
very good information. Thank you.
Thanks, Anne.
Thank you, Grahame.
Nice to see
Thank
you.
you.
Nice to see you.
Thank you. So
it's turned 8 o'clock, and I don't
yeah,
wish to
that's
be
fine.
rude,
No, we
Davina,
want,
but I'm
yeah,
going to
no,
have to go because
that's lovely. Thank you very much for your time and your presentation. We
it's been
really
a
do
pleasure, and
appreciate it.
it's lovely to see everybody. And Eric,
Thank you.
will you keep in touch with me, and I'll reciprocate and see what I'm able to find out, and I'll contact those MPs you identified and see if we can form
Yeah, I'm going to try and save the
common
chat. I don't know if
front.
anybody knows how to save this chat. So if somebody can do that. Thank you so
Yeah.
much, Grahame. We really
Cheers.
appreciate your time and thanks for the
Thank
lovely
you.
I'm sorry for me
presentation.
cough.
Thank you so much. Thanks, everyone. Did anybody else have anything to say?
Davina, would it be worthwhile if the knowledge within this group creates like a template that everybody could then use to MP, GP, consultant?
How do you mean? Like all the valid points?
But some kind of letter that those can to communicate with those that might be able to, with the power coming from the bottom of the swell of people saying the same thing. If it was coming,
Carrie Ann's sort of written some good points in the chat as well, and I think is Carrie Ann still here? Because she had some other information about where you can source injections, I think.
Yeah, she's just replied she's there still, Davina.
Okay, Carrie Ann, would you like to just say a few words before we close the meeting? Yes, she's saying yes.
There we go.
Oh, lovely. Thank you. You've written a few points. If you just like to go through them quickly, and then I'll go on to Homer. Yes.
Yeah, that's fine. Yeah, I mean, literally, it's probably what everyone's heard before, but I think Annie Barr had a good point with regards to just with sort of putting the point across to Grahame about just in connection with Alzheimer's and dementia. You know, when I can't never remember everybody's names, but the person that did that study and came out just in connection with that, if the levels are raised to over 500, then hopefully they might start to you know, some of the dementia and Alzheimer's symptoms in people may start to reduce, but they don't. But also doing a test routinely for B12 deficiency would
the
hopefully
tests aren't
help
that
with that.
accurate, isn't it? That's what they said.
Yeah.
So it's really based on your symptoms, really. But if they increase the lower level, then that would really help. That would go a long way, because I know a lot of people are getting symptoms below 550, and they're saying below 550, if you get B12 below 550, then your homocysteine starts to raise at a level which is going to give you more risk of heart attack, strokes, and dementia, all those sort of things. And Patrick Holford's also done a lot of studies with David Smith, which corresponds to that sort of fact.
Yeah, that's it. And I just there was a few things on there, but I can't really remember, to be fair, what I wrote on there. But I was just kind of conscious that was probably a lot of questions, and poor Grahame didn't have a lot of time. So
I know
that group chat hopefully can go to him, and maybe he can summarize some of the bits that.
I mean, I'll put across to him through Hugo some of the points that I feel are important that were raised in this meeting as well.
No, thank you, everybody, and thank you.
No, that's fine. I think 2 people have got their hands up, so we'll just quickly do that first. So, Anne, did you want to say something? Because Alpha's waiting as well.
No, I was just concerned that the government listen to pharmacists who want to sell expensive drugs instead of a simple vitamin that can do the job.
It's all to do with the money. Alf, would you like to finish off, please?
Yeah, agree with all, and Homer, you said it's not just B12, it's other vitamins as well. I would like to mention B1, thiamine as well. It's a great book about thiamine, about Derek Lonsdale has written. And
would you send a link to us in the group, please?
I would. He is 99 years old and he still is writing. So it's
wow.
But they're working together, these vitamins, not alone. Okay. So magnesium as well.
Yeah, vitamin D we know we're all deficient of, and yet the government
Yeah,
doesn't promote the level at which we should have it.
but also
It's so
thiamine is a big issue.
yeah, there's lots of them, and the trouble is because we don't know enough about everything, everyone's kept in the dark. Sadly,
Yeah.
you have to do your own research, unfortunately.
A friend of mine were actually taking thiamine in big doses for a month, based on science research in Denmark. And he got well from fatigue and Crohn's disease about 30 days and been sick for years. So
what would you send the details of that in the group as well?
Yeah, I can. Yeah,
that would be lovely. Thank you.
Yeah,
That'll be helpful for everyone.
Yeah, so it's very important to recognize. I'm not an economist and I'm not a GP, but it's important to realize that this works. These vitamins work together. If you take one more than the other, you have to supply with the others as well. So
yeah, because they say really in foods, nature, all the vitamins don't come in as sort of like how we get it in supplements. So that's why they recommend food. But obviously the food doesn't have as much stuff that we need.
Yeah.
So it's all a case of balancing everything. So.
And also I have a doctor in Norway who lost his license twice now because he gives vitamins and does these things.
That's terrible.
He does these things. You actually are. They want them to do because it's simple things, vitamin C injections, but the health departments don't like that he does things like this.
Sadly.
But
any information you have to share, if you just pop it in the group for us.
Yeah, he might be willing to be with the group someday, but we'll see.
Yeah, if he wants to do a talk, just get in touch with us and we can arrange that as well. Yeah. Because it's all related to the group and it will help everyone's knowledge. Increasing knowledge is always something that we're always looking forward to.
Yeah, it's very knowledge. It's helps a lot of autistic children.
Oh, okay. Yeah, because a lot of autism is due to B12 as well, isn't it?
Yes,
it's related.
Yes.
Yeah.
It is.
Okay, lovely. I think there's 2 more hands come up.
Yes.
Sue and I think Homer.
Sue, should I send my contact information when mentioning her? But I don't know if she's there still.
Who's that?
No, she told me to send the contact information for me so he could send it to Grahame.
Yeah, that's fine. That's me. Yeah. If you just send it to me directly. Yeah.
Sorry.
Sue, did you want to say something? Thank you. Thanks, Alf.
Yes, I'd like to just say that, yes, we all know that diet is really, really important. But one of the things that upsets me a little bit is when we are pushing all these comments about diet, and it does make people feel almost guilty for having their disease and their deficiency. And diet doesn't always cause B12 deficiency, not in the context of autoimmune gastritis and pernicious anemia, where we know there is a genetic and familial tendency. And much as we'd all like to have wonderful diets and good food, you've got to realise, just like Grahame mentioned, that in deprived areas, some people simply don't have the money to buy all these vitamins and have all these organic foods and wonderful food products. And we do know that the quality of our food is deteriorating.
Yeah.
But please don't constantly make people feel guilty about getting a disease and then saying, well, if you'd had a good diet, it wouldn't have happened.
No, I don't think the intention is about that. I get what you're saying.
Yeah, I think it's just be a bit careful about that, because diet isn't the only cause. And even if it is the cause, sometimes people don't have the facilities or the money or the economic or social and welfare backgrounds to be able to solve it.
Yeah,
so
the main problem is obviously the processed foods, because it has so much bad food in them, things that it's quite poisonous, isn't it, really, with the toxins that are in that processed foods. And I think because of the eating processed foods, it can actually ruin your stomach. I think that was the main point of it. It wasn't to say that, because you're not eating well. It's just because when we eat those sort of things, you get inflammation in the body, and that causes a lot of health series of issues. But I completely take on board what you're saying, because not everybody's got access to the foods, and some people might not have the knowledge. But I do get what you're saying. And I don't think it was meant in that way.
Okay.
But thanks for raising that point. Did anybody else have anything, or shall we close now?
Just say I totally agree with you. I don't believe that diet is. I don't think the diet is in any the cause of this, because it's the problem is the shops. Here in Norway, where I live, we have like 10 different shops with different brand names, but they all sell the same.
Mhm.
The highly processed food, and how you're gonna eat more healthy. But I don't think the problem is that the ground or the vitamins is not the same today as they was for 20 years ago. So I don't. If you can eat how healthy you like, but I don't think that will help, especially in B12 problems.
Yeah, I mean, I think like for me, diet has actually helped, because you know, if by knowing certain things, I've been able to adjust my diet, and that's been very beneficial to my health. So that's why I tend to promote diet and lifestyle.
Yeah, of course,
because,
of course.
yeah,
Of course.
because everything's important. Lack of, you know, not being stressed, being happy, be thinking positive. There's so many factors. So, and
of course,
and the group's there really to support each other, really, and share the knowledge. It's not trying to attack anybody, or you know. But I completely, you know, get what was just said. You know, in terms of, you know, it's not just the diet. Sometimes it could be the genetic factor. There's lots of things that affect your B12 and other vitamins.
But I don't mean that diet is important. Of course, too much sugar is not good at all. And
sugar's terrible, but it tastes good.
But in the vitamin issue, I don't think the diet is enough, because you have to.
Yeah, it's a combination of lots of things.
Yeah.
Yeah.
So
Thank you.
I agree.
Well, thanks everybody.